So, if you have valve stenosis, that basically means that the valve structurally has either gotten some calcification or fibrosis to make the opening smaller. And so, basically, if you have, let's say, this is the valve opening, and then it gets some sort of like structural change, fibrosis, calcium, you could see where the valve then won't have as much of an opening to send blood through. And so, when your heart is trying to push blood through, there won't be as much area for the blood to move through. And so, basically, that can happen for a variety of reasons, but the symptoms you would have generally, if you have mild valve stenosis, you wouldn't have any symptoms. But signs that it could be progressing would similarly be that, because blood is not able to get through the valve as much, it will get backed up and then you'll get fluid buildup as well because the fluid is getting backed up. And that usually is first noticeable on your ankles and legs that you're getting fluid buildup and it's persistent. So it doesn't go away when you elevate your legs. And then usually the next symptoms are or symptoms you may get at the same time that are signs that your valve stenosis is moderate to severe, is that when you try to exert yourself or exercise, lift anything heavy, go up the stairs, usually your heart will respond by trying to push more blood through the valve, and it won't be able to because there's not as much room in the valve opening for it to push blood through. And then so you would usually notice when you exercise or going upstairs or lifting anything heavy that you would feel dizziness, lightheadedness, you may even pass out. And sometimes you would also have chest pain or shortness of breath when you're trying to do those things. And that could be a sign that if you have mild valve stenosis, it's progressed and you should go see a cardiologist right away.